talked about screening, seeing who's appropriate, seeing who's inappropriate. And there's always an exception to the rule, but a lot of times distance counseling is appropriate and beneficial for clients that may have social phobias. You know, maybe have a lot of anxiety when it comes to going out into the community, or even going really, really far, or just having anxiety when it comes to interaction with people, period. And so that distance counseling kind of brings that comfort level to them when you have social phobias. And then people with anger management, you know, it's good to use distance counseling because a lot of times you can just give them the skills and, you know, give them assignments to see how they work on it, and then you can be able to move forward. Grief and loss, depression, anxiety, stress management, and lack of accessibility and lack of transportation. We talked about that earlier. Your lady audience said how sometimes people don't have transportation to get to an area or a physical location. So that would be an appropriate type client. But it's also asterisk by those because sometimes you may have clients that may be like on the borderline of inappropriate for long-term or distance counseling. And so, for an example, moderate post-traumatic stress disorder, they might have that, but yet they don't have transportation to get to a physical location. So you can still offer distance counseling to them. However, you want to have some combination of services. Okay? Now, some inappropriate clients will be people with psychosis that have had suicidal or attempts before, or active suicidal thoughts, minors under the age of 16. Now, you may say, well, those are kids that are using technology the most, you know, but with any minor, you have to consider ethical guidelines and what's appropriate and what's not appropriate. So, but 16 and older, you're using their cell phones all the time too. So it's a good way, distance counseling, like the young lady said, it's a good way to reach people that are just technologically driven. All thing they're doing is using their cell phones or always on a computer or even social media for that aspect. You want to be able to meet them where they're at. And lastly, the other areas that are not so much inappropriate are active substance abuse users or addictions, child or elder abuse, severe post-traumatic stress disorder, and dissociative episodes. Okay? Any questions so far? You guys are doing good. Like guys, we're going to move forward. We're going to talk about the benefits of distance counseling. We're going to have my co-presenter, Amanda Thomas, move forward. Thank you.
Hello, everyone.
There we go. I kind of like to move around, so I'm going to use this wireless thingy bob.
key to what we do. So with distance counseling, we may not have that available to us. So we are going to have to make adjustments, and each individual will have to decide that for themselves, okay? Next, we're going to talk about attending skills. I'm going to ask a volunteer to read that for me.
In order to build a firm foundation in any supportive or caring client-counselor relationship, strong and clear defined attending skills must be evident. These are skills that require counselors to be present in any situation, giving their full attention and listening to the client at all times.
How many are all familiar with that? You all practice attending skills now, right? So we know that we have some basic attending skills and some advanced attending skills that we utilize. Open-end, closed-end questions. You're still going to use that when you're doing distance counseling. You're still going to make sure to check for concreteness, clarifying, using paraphrasing, summary, reflecting skills. You're still going to be doing those things. You're going to be doing some disclosures. It may be a little bit challenging for clients to disclose distance counseling, but some of the research is saying that it's easier for clients to disclose because when you're doing the distance counseling, the clinician or the client actually has the option to either be seen on, if you're doing it via web, to be seen or to not be seen. How many of you are doing distance counseling now?
Great.
So let me ask you guys, what are some of the things that you're seeing when you're doing your sessions? I'm going to go over to Dr. Young.
I have one client that, well, since we would have the Rocky Mountains here, when she can't make it down because of snow and stuff like that, we do a phone conference, and I can tell you on those times, she discloses more, talks more, etc.
Yep.
And I also noticed the one thing that when we're in the office, she gets more confrontation, gets more, what do I want to say, pushback. If I confront her, resistant, thank you. If I confront her about her things. Whereas on the phone, she doesn't. So if I confront her about, geez, I'm wondering if you're experiencing this, because I confront gently. But in the office, she gets angry with me, she'll push back. On the phone, she doesn't do that. So I just noticed these little differences, and it's kind of very interesting that I get to see both sides of her in those different settings. So.
Okay. And then interpretation. When you're doing distance counseling, you have to make sure that you're interpreting what the client is saying and that you're hearing the message that they're trying to relay to you. That's very, very important. Immediacy. Dealing with, I'm sorry, I have a question in that.
Oh, no, I was just going to say, what I noticed in distance counseling is if I'm writing, they can't see my eyes. So that's because I write a lot of notes. On a computer, it's really hard to write notes because
H1 says knowledge and legal considerations. I have people that are in the audience that are reading for me.
I have H1.
H1.
Counselors ensure that their clients are aware of pertinent legal rights and limitations governing the practice of counseling across state lines and international